Simply Women's Health with CJ. So it turns out that you had unprotected sex, whether it was your condom broke, you forgot to take your birth control pills for a few days, you were a couple of weeks late on your Depo shot, or God forbid, something bad happened. You were sexually assaulted, and you really, really do not want to be pregnant. Good news. There is emergency contraception that is available to you, and it can drastically decrease your risk of becoming pregnant. There are a couple of different kinds available. Some require you to go be seen by a healthcare professional, and some you can do over the counter. The most effective form of emergency contraception is an intrauterine device. It can be placed in either your OB provider's office or at Planned Parenthood. There's two different IUDs. There's a non-hormonal IUD, the copper IUD. It is good for 10 years. And there's also the hormonal IUD, Mirena. That can be good for 8 years. As long as the IUD is placed within 5 days of unprotected intercourse, it decreases your risk of getting pregnant by 99.9%. And bonus, it gives you very effective birth control for, again, 8 to 10 years going forward. If you do not like the idea of an IUD, but you really, really don't want to get pregnant, there are some pills available as well. The first one is Plan B. That is available over the counter. You do not need a prescription for it. However, in some states, you will have to ask the pharmacist. Some states, the pharmacist actually has the right to refuse to dispense it. So before you go shopping for Plan B, I recommend you call around and see where it is available to you. If you're uncomfortable going to the drugstore to get Plan B, your partner can get it as well. It does not have to be sold to just women. The Plan B is a single pill. You want to take it within 72 hours of unprotected intercourse. There is another pill that is available. This one you do need a prescription for. It is called Ella. It is a hormonal blocker, so it prevents your body from ovulating. Now, this pill does, again, you have to have a prescription for it, but it can be taken within 5 days of unprotected intercourse. So it's a good product which gives you a little bit more wiggle room after you've had unprotected sex. There are some hormonal birth controls that you can use. Again, those would be prescribed by your healthcare provider. Now, if you do elect to take any of these pills, you might have some side effects. You might be a little bit queasy, you might have headaches, you might feel tired. You probably are going to have some irregular bleeding after you take this. These products are not perfect. If you have not gotten your menstrual cycle within a week of when it was due, I recommend that you do take a pregnancy test just to make sure that you are not pregnant. Here's the thing about emergency contraception. It does not cause abortion. If there is a pregnancy that is already underway, the emergency contraception is not going to terminate that pregnancy. And if you're using the hormonal forms, such as Plan B, that actually is going to help the pregnancy along. So again, if you have had unprotected intercourse and you do not desire pregnancy, please seek emergency contraception. Hi, if you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement for a visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.